My name is Erika Ruiz, and today I will be exploring the research question of how does a physical/emotional trauma affect speech and what can be done to cure it? To start off with this topic, I will explain what a speech disorder is. By definition provided by Medline Plus Medical Encyclopedia, a speech disorder is a condition in which a person has problems creating or forming the speech sounds needed to communicate with others. Speech disorders vary greatly from patient to patient. Two examples of a speech disorder can be a stutter or selective mutism. A stutter, also known as stammering or childhood onset fluency disorder, is a speech disorder that affects normal fluency and flow of speech. Symptoms can include the repetition of a word or syllable or addition of extra words. This disorder is mainly common in young children when their speech abilities aren't fully developed. Selective mutism is mainly common in children who also present an anxiety disorder. Patients who suffer from this speech disorder tend to have an inability to speak in social settings, but are able to communicate in an environment where they are comfortable. To further understand the topic of a speech disorder, it is crucial to see the root of it. The question is how a physical or emotional trauma can affect speech. Provided through medical news today, there are many possible causes of speech disorders, including muscle weakness, brain injuries, degenerative diseases, autism, and hearing loss. It has also been proven that many kids who present a speech disorder also show signs of abuse. Physical trauma, such as traumatic brain injury, also known as a TBI, affects speech. A TBI can result from closed head injuries such as being in a car accident or suffering from a concussion. An injury to the head can include skull fracture or nerve damage. As a result of a TBI, patients now experience problems with their speech, such as not being able to find the correct words or ways to get their message across. Problems with communication skills consist of finding it difficult to take turns in a conversation, maintaining a conversation, and responding to facial and body expressions. In a video presented by neurorestorative speech-language pathologist Jessica Buckley speaks on the topic of brain injury and speech. The speech disorder mentioned is expressive aphasia, which causes people to have difficulty when expressing what they want to say. For instance, instead of saying, "pass me the spoon," they may say, "pass me the moon." Expressive aphasia can be caused by a TBI or a stroke. Your brain is divided into the left and right hemisphere, in which each side controls various functions. A TBI affects speech due to an injury on the left side, which controls speaking, writing, and reading. An important fact to point out is that even if only the right side were injured, it would still affect the left side, as the right side controls the left and vice versa. Injuries on the left side can result in difficulty understanding spoken and written language, difficulty expressing spoken and written language, changes in speech, and verbal memory issues. Moving on to emotional trauma and speech disorders, a speech disorder can result from growing up in an abusive environment. Such disorder is most evident in patients who experience child abuse. A study done by SLP Julia Bernard Welk, MA, proved that 60% of children in foster care presented some form of speech impediment. Additionally, it proved that there is a correlation between speech and abuse, as the brain is highly affected by the environment during early childhood as it is developing. Traumatic stress experience can cause changes in brain development, resulting in an impact in speech and language development. In a video presented by UK Trauma Council, it explains the topic of how childhood trauma plays a role in the development on the brain. A brain that is put under threatening situations then causes a person to be unable to survive properly in any other environment. A study was conducted in Australia to view the association between trauma and speech on border personality disorder patients. BPD patients often show symptoms of intense emotions, impulsive actions, and paranoia. This research included 12 BPD patients and 12 healthy controls as the subjects. Before beginning the research, tests were completed on all subjects. These tests were demographic questionnaire, assessment, self-report measures, dissociative experience scale, childhood trauma questionnaire, and screen for post-traumatic stress symptoms. These tests were completed with the purpose to identify trauma in each subject, such as depression, post-traumatic stress, and childhood trauma. Once this was completed, the next step was to identify effect of trauma on expressive language. These tests were requirement of speech samples, neutral stimulus, emotive stimulus, analysis of transcripts, idea density rater, shallow syntactic complexity rater, and analysis of audio files for pauses. Each test was conducted by having them do certain tasks, such as describing their morning, then given an emotional rating. All subjects gave between a 3 and a 5, 3 being slightly unpleasant and 5 slightly pleasant. After concluding the test, they were all analyzed and studied for results. Overall, scientists were able to conclude that correlation between difficulty in expressive language and BPD subjects were present, supporting the idea of an association in emotional trauma and speech. For instance, for the test with neutral condition, the healthy control subjects performed better than the BPD, supporting the literature reporting an association between the emotive clinical context and the presence of deficits in expressive language in BPD patients. Furthermore, when looking into relationship with family, the BPD patients took more pauses when speaking on their early relationship with their mother. No differences between subjects were found when speaking on their father. Overall, some emotional trauma such as PTSD was associated with expressive language impairments, but not all emotional trauma proved a correlation, as depression and dissociative phenomena were not proved to be related to expressive language impairments. This study showed that some patients suffering with emotional trauma do present expressive language impairments, but not all emotional trauma causes a development of a speech disorder. To learn further about how speech is affected under certain situations and emotions, I performed a survey with 3 different questions and received 62 answers. The first question reads, when I speak in front of a large crowd, 13 people answered, I begin to stutter. 17 people answered, I speak faster than normal. 3 people answered, I forget what I'm supposed to say. 6 people answered, none of the above. Lastly, by majority, 23 people answered all of the above. These results show that by being put on the spot, people experience a reaction under speech. People tend to experience fear and anxiety by having to present in front of others, supporting the idea that emotions have an effect on speech. Secondly, we have when I feel under pressure slash stressed, 12 people answered, begin to stutter. 9 people answered, speak faster than normal. 18 people answered, forget what I'm supposed to say. 7 people answered, none of the above. And 16 people answered, all of the above. By analyzing the result, we see again that most people prove to be affected by their emotions when trying to communicate. Lastly, we have when I am reminded of a stressful event, 9 people answered, begin to stutter. 12 people answered, speak faster than normal. 11 people answered, forget what I'm supposed to say. 11 people answered, all of the above. And by majority, 19 people answered, none of the above. A research conducted by researcher Paul Brocklehurst stated that post-traumatic stress triggers stuttering in people. Post-traumatic stress is the event where a person is reminded of a past traumatic event they experienced. It is believed that this triggers stuttering as the body goes into flight or fight mode. However, empirical evidence based on this topic is unreliable, leaving the topic unanswered. Through this survey, it has been shown that the majority of the public experiences no change in their communication skills. Now that we have learned about emotional and physical trauma and speech disorders, we can view how they are cured. Here we have a logo for ASHA, which stands for American Speech Language Hearing Association. ASHA plays an important role in speech disorders as it is a national organization made up of about 218,000 members, who are audiologists, speech-language pathologists, speech-language and hearing scientists, and audiology and speech-language pathology support personnel. ASHA's vision is to improve communication and make an accessible environment for all. Speech pathologists play a very important role in speech disorders as they are responsible for treating them. In order to learn what a speech pathologist is, I interviewed speech-language pathologist and Associate Director of ASHA, Rebecca Politis. SLP Politis describes speech pathologists as healthcare professionals who specialize in both communication and swallowing. Through communication, they focus on thinking skills and language words that are used to communicate. With swallowing, they focus on a person's ability to eat and drink by mouth. Politis discussed that SOPs are crucial to healthcare for the patient's safety. For instance, in a hospital, it is very important that the patient is able to communicate with the staff on how they're feeling and their pain level. It is also important as communication allows people to participate in life. Rebecca Politis currently works as an associate director at ASHA, but worked for many years at a hospital. SLPs can work in many different settings, such as at a school, clinics, or nursing homes. A day at hospital begins by printing out a list of patients. Some patients may be new or have already been there for a few days. As for freedom and therapy sessions, for the most part, Pilates described that you don't have to ask on what you do or get approval of any sort, except on getting signatures from doctors in order for patients' insurance to pass. SLP Pilates explained that when working with a new patient, you begin by completing a chart review. This chart review means that you read on why they're in a hospital. It is important to check on the patient's background. Have they seen an SLP before? Have they had surgeries? Are they on a diet? Are they bilingual or will they need an interpreter? It is important to know your patient in case they need any special assistance. Rebecca Pilates also expressed challenges in the field. This job is both emotionally and physically draining, she said. By working in a children's hospital, you see many sick kids, have to inform people of bad news at times, and be on your feet all day. Another challenge expressed was that at the end of the day, a hospital is a business, meaning that if a patient needs more therapy but their insurance is unable to cover it, they sadly cannot continue. Lastly, some workplaces may require more of your productivity time to be spent with a patient, such as if they require 90% of your time to be with a patient, it leaves little to no time to eat, to use the restroom, to talk to a patient's family, or a social worker. Lastly, Rebecca Pilates shared the most rewarding part about the job. Pilates shared that it is special that you're able to build a relationship with people and improve their life, whether it is in a little or big way. Pilates stated that when you lose your communication skills, you lose a part of yourself, your identity. It is devastating, but to be able to give that back is rewarding. In conclusion, to cure a speech disorder varies as therapy sessions include many different methods. They all are performed to target the patient's disorder. These sessions may include problem solving, memory and organization activities, conversational tactics to improve social communication, or language development games such as flashcards or workbooks. This concludes my presentation. I hope that this brought awareness to speech disorders and the importance to aid those who have lost their ability to communicate.